There are 4,000 community health workers or community health assistants, CHAs, like John Flomo, bringing health care literally to the doorsteps of people in remote communities in all of Liberia's 15 counties.
Hello.
Their primary role is to diagnose and treat children under 5 for pneumonia, malaria, malnutrition, and other health problems.
Yes, it's positive you have malaria.
They also focus on community health education and disease surveillance and prevention.
Our training how to prevent other diseases that can affect our community people. The measles, the polio, we make sure our children take the vaccine on time.
They are now also leading COVID-19 prevention and vaccination campaigns in their communities.
To encourage my people, I was the first, as you can see my card, I was the first to do my vaccine.
In a country with a low doctor-patient ratio, the community health workers are really the main provider of primary care for thousands of people in Liberia.
In my catchment area, I control 277 households.
506 persons in my catchment community.
On the average, do my normal routine visit, I talk to close to 20 households per day.
Cases they cannot treat, they refer to the nearest health facility.
Because of their quick referral, since I took over 2019, I never experienced any maternal mortality death in my facility.
Indeed, since the community health scheme officially launched in 2016 in the wake of the Ebola epidemic, it has made startling progress. About 70% of Liberia's 700,000 rural residents now have access to care. A study published in August found that community health workers now treat 45% of all malaria cases among children under 5, with that figure rising year after year. The number of malaria cases treated in less than 24 hours rose from 12,807 in 2016 to 93,530 in 2020, according to Ministry of Health data. No wonder the community health program in Liberia has drawn international attention. The Daily Telegraph newspaper of the United Kingdom recently hailed the program, noting that community health assistants are a crucial cog in Liberia's fragile healthcare machinery. And here is what a major health publication, Exemplars in Global Health, say about Liberia's community health program. The speed of the scale-up of Liberia's premier community health worker program, the National Community Health Assistant Program, is remarkable, given the country's extreme poverty and recent history of civil war and epidemic. Liberia, the exemplar said, took a proactive stance with donors. It did not merely accept donors' plans, but instead responded to funders' offers with its own research and vision to maximize impact and fill critical gaps. Last year, a delegation from Jordan visited Liberia to observe the community health program and how they can apply lessons learned to their own community health program.
The model of community health that we have in Liberia is now being replicated in other countries on and across and outside of the continent, because the community health program in Liberia has really revitalized primary health care.
Many things explain the success of the community health program in Liberia. First, the CHAs come from the very communities they served and are nominated by the people in those communities, creating a strong bond and trust between the CHAs and their communities.
Live in this community, born here, grew up right in this community, and have my wife and children all in this community, well respected by my community people.
All of the CHAs must have at least a 6th grade education, pass a written test, and then go through a rigorous 4-month training.
As I was trained as a CHA, I was trained in all the modules that needed to be used in my community. And that's what make me today to learn how to treat some common sickness.
Another key to the success of the Community Health Program is the very close supervision of CHAs by Community Health Services Supervisors, CHSS, who are registered nurses, physician assistants, or certified midwives.
Okay, what's the museum of routine physical?
No wonder the Liberians who run this program take great pride in its success.
But this activity Scale Up is being run now by totally Liberian staff, and we are seeing ourselves like we are held liable and responsible now to take our own situation of our country health in our hands. So we are working with all of the stakeholders to ensure that this Liberian team succeeds in the implementation of this project.
But despite the successes, there are some problems.
The major challenge right now we are having is the availability of drugs. So when CHA have drugs, it also boosts the morale of their work they do.
For now, though, as the Telegraph noted, thanks to the Community Health Program, Liberia's poverty-stricken, remote and rural communities are benefiting from improved access to health care in a way that is revolutionizing the fight against infectious diseases in sub-Saharan Africa.
CHA, we are here. Maternal mortality, one reduce. Family planning, one increase. Pneumonia, sempre foi todo clean.